Hi, and thanks for joining us today. I'm Stephanie Mazzucca, and along with Sarah Pritchard, we'll be sharing our ongoing work with a community partner to identify and share different visions and goals among a council responsible for implementing community gardens in Southeast Missouri using group model building. Although we have effective programs and policies to prevent and treat chronic diseases like cancer and diabetes, public health practitioners and researchers still face a growing burden of chronic diseases at a population level. This discrepancy suggests that there's a dynamically complex system contributing to policy resistance. Understanding more about this system can inform implementation science approaches to addressing this discrepancy. There are many opportunities and settings to implement evidence-based programs and policies. We're focused on community settings, that is, those that are outside of clinics or hospitals. These programs often have multiple components focused on different levels of the socio-ecological model and are often overseen by interdisciplinary groups representing various private and public sector organizations. So it's often a lot of people coming together, each with their own priorities, and it's important to understand the different mental models when we're determining the best implementation approach, one that is relevant to stakeholders and supports effective implementation. For this project, we're partnering with a nonprofit organization in Southeast Missouri. Their overarching goal is to promote the health and well-being of children and families in their county. Among other initiatives, they lead a wellness council that focuses on healthy eating and physical activity, including community gardens. They're at an inflection point in the expansion of the gardens, so this is an opportunity to ensure that a cohesive vision is guiding their implementation. So this project is focused on using GMB with the Wellness Council to help them develop that shared mental model of how to successfully implement community gardens. We're interested in how GMB can be used to select implementation strategies that are relevant to stakeholders. So another goal is to identify potential places to intervene to ensure successful implementation. We had two phases. In the first phase, we engaged the core modeling team in a mini GMB workshop online. Our goals were to increase the familiarity with GMB, to build their capacity, to inform the design process in phase two, to test online facilitation approaches, and for the research team to gain understanding of the council and the history of the local gardens. We created a small causal map of how stakeholders might understand the system structure that determines garden success. We're currently in phase two, focused on developing a shared mental model among the Wellness Council. We conducted 5 interviews of council members and used this information to inform the core model team's work to design the workshops. Next week, we'll facilitate a 2-day outside GMB workshop with the goal of making explicit the council's diverse mental models of a successful community garden and identifying places to intervene.
One of our insights has been the importance of spending a lot of time on problem scoping and developing our community partners' familiarity and capability with group model building. For the initial engagement and audition, we actually led them through a 3-hour mini workshop online rather than just a single modeling script. The motivation for that was to give them a solid foundation in group model building, but also for us to better understand what problems they were facing so that we would all be ready to do the design work in phase two. Additionally, because we had to do this online, that initial engagement ended up being much more scripted than it would be if we were just having a CMT problem scoping meeting. And in terms of online facilitation, we had success using Google Slides versus something like Miro. And we thought carefully about the tech capacity of our partners and how to minimize tech-related distractions to really focus on the GMB experience. And in designing phase two, we capitalized on the opportunity to use existing practices for doing GMB outside, rather than assuming that COVID necessitated us doing an online approach. Our participants have tech constraints that would have made doing online GMB inequitable, so we drew from existing GMB practice to do it outside. Also, the pre-workshop interviews have been really instrumental in helping us understand the different participants' mental models, as well as their competing goals for the garden. We also realized that some of the participants didn't know as much about the topic than we thought that they would. So given that one of the goals is to get everybody on the same page, the interviews really spurred us to make some changes to the workshop design to ensure that that will actually happen. Some of this lack of knowledge may be due to high turnover within public health. So we're interested to see if the boundary objects created in the workshops can promote retention of institutional knowledge within the council, even if individuals turn over.